So before I approach the scene, I'm going to wash my hands for 20 seconds and put on my personal protective equipment. This would be my gloves and my goggles. So I'm going to approach the scene and make sure that it's safe. My first impression is that I found a male who seems to have fallen down the stairs. I'm going to ask him to continue laying on his back at the bottom of the stairs. Hi, my name is Melissa Calcavecchio, and I'm a physical therapy student. Can I help you out today?
Yes. I fell down the stairs while carrying a box. My ankle hurts and I have a headache.
Sir, did you hit your head when you fell?
Yes.
I'm going to have my partner hold his head in a neutral, or I'm going to have him hold C-spine in a neutral and inline position. And next I'm going to assess for any immediate life threats. So I would consider this a serious injury because he has hit his head and might have a brain injury, so I'm going to call 911. Next I'm going to assess his responsiveness. Sir, what is your name?
Jerry.
How old are you?
44.
Where are we?
At my house.
Do you know what year it is?
2020.
And why are we here?
I've fallen down the stairs.
So I would consider him to be alert and oriented times 4. Why did you call today, Jerry?
I was lifting a box and slipped down the stairs. I fell, I rolled my ankle, and hit my head on a step.
Okay, next I'm going to search the patient and see if there are any life threats, and I do not seem to have found any. His airway is clear because he is talking to me. Next I'm going to assess his breathing for rate, rhythm, and quality. His breathing rate is 20 and he has strong and equal breaths. Next I'm going to assess his pulse at his radial pulse. They are strong and equal and he has 84 beats per minute. Next I'm going to assess for any major bleeds, which I do not seem to see any. And I'm going to assess his skin, which feels dry, cool, and looks pink. Next, I'm going to assess his history. I'm going to ask the onset, provocation, quality, radiation, severity, and time of his pain. When did the pain start?
As soon as I fell.
Does anything make the pain feel worse or better?
Lying down helps my headache, but my ankle pain is consistent.
Can you describe the pain?
Both are sharp and throbbing. They haven't changed.
Does the pain seem to move anywhere?
No.
And on a scale of 1 to 10, 10 being the worst pain you felt, how is the pain right now?
My head is about an 8 and my ankle is a 9.
How about when it started?
My head was a 9, but my ankle stayed the same.
And is the pain consistent or does it come and go?
They're both consistent.
Okay. Next, I'll move on to his sample history. His signs and symptoms include a headache, a swollen right ankle, and pain in the right ankle. Sir, do you have any allergies?
No.
Are you taking any medications?
No.
What is your pertinent medical history?
I broke my right leg once.
What is the last thing that you ate today?
I ate eggs and toast for breakfast.
And what were the events leading up to this?
I was bringing Christmas boxes downstairs and slipped and fell.
Okay, next I'm going to move on to my secondary assessment. Since he seems to be complaining of a head injury and a leg injury, I'm going to assess his head and lower extremities. Alright, I'm inspecting and palpating his head and scalp area. Sir, does it hurt here?
No.
How about around here?
No.
Okay, how about when I feel the back of your head?
Yes.
Okay, I notice a bump on the back of his head and I'm going to make note of that. Next, I'm going to assess his mouth and nose. Sir, does it hurt anywhere around here?
No.
How about when I touch your nose?
No.
Alright, there appears to be no pain, no bleeding, or bruising around the face. I'm going to assess his eyes for pearl to make sure that his pupils are equal and responsive to light, and make sure that his pupils are also round. I would shine a light in them, and yes, they are. Okay. I would also assess his ears, look around them, and see if there is any bruising, or is there any pain when I touch your ears?
No.
Okay. Next, I'm going to move on to the legs. Sir, does it hurt when I touch? I'll